Hi everyone, and welcome to this week's episode of Tubules Live. Today we are very privileged to have Dr. Paul Baker with us. So welcome to the show, Paul.
Thank you.
You've already done a short Tubules Live video for us, which I'm sure many of you have seen already online, but if you haven't, make sure you check that out. So for those who don't know Paul, he's a very experienced specialist periodontist. But Paul, just tell us a little bit more about your background. Where did you graduate from? Where are you working now? What have you done in between?
Well, I graduated at King's College in, too long ago to remember, 92 I came out. And after a few years working in hospital, oral surgery, those sorts of usual bits and pieces, general practice, I was at a bit of a loss of what to do. And I signed up to the Perio MSc at Guy's Hospital in 1996 and really never looked back. I just found a little niche of dentistry that I thoroughly enjoyed doing. So I've been a full-time perio specialist since finishing that in 2000.
And you're still enjoying it?
Yeah, I love it. No, I really do. I enjoy what I do. It's all perio and implant surgery. Don't do any of the other general dentistry, but work with some wonderful people and yeah, really enjoy it.
Fantastic. And where's your practice at the moment? Are you based in London?
I'm based in the centre of London. I'm in the West End, which is a nice place to be, mostly because dentistry can be quite isolated and insular, and the fact that in the West End you've got so many people around you, fellow professionals, it's just a very nice working environment. Great.
And I understand you do some teaching as well. Just tell us a bit more about that. Is that for undergraduates or postgrads?
I'm limited in my teaching now. I used to teach undergraduates. Now I do a little bit at the Eastman CPD Centre, which is a certificate and diploma course. So I do a few days there teaching qualified dentists a bit more about perio. And I do some mucogingival periodontal plastic surgery courses. I've done master classes for the BSP. And I also do a course each year up in Manchester at Mandek with Chris Butterworth, which is a hands-on course on this sort of thing, which I'm not trying to plug, but I do it because I thoroughly enjoy it, and I think that works quite well.
Great. So today's topic is 50 years of perioplastic surgery, the uses, the techniques, and also the indications as well. So why did you pick this topic? Any particular reason? Is this your sort of special niche?
It's a bit of perio that I've always enjoyed. I think I spend most of my life treating moderate, advanced, aggressive perio. That's what I do. It's my bread and butter. But I didn't become a periodontist to clean teeth. I became a periodontist because I enjoyed surgery. And this is a topic that we often turn to, periodontists, when we're lecturing, because it's a bit esoteric, a bit interesting. People don't know quite so much about it, but also it's a chance to show off and show what we can do. So I chose this. I know that you've already had Matt Perkins do a talk on perioplastic surgery, and I hope that I put together a talk that will complement that rather than fight against it. So I hope the two will work together well, and I've taken it in a slightly different direction to the way that he's done it.
Okay, great. So I'm definitely looking forward to this one, and I'm sure all of you watching online are as well. So without further delay, I'd now like to hand over the floor to Paul to kick off today's show.
Well, thank you for that introduction, and thank you for the invitation to come and speak to Dentinal Tubules. The topic I've chosen was 50 years of periodontal plastic surgery, and as I've said, it's because it's a subject that I find particularly interesting and fun to talk about. As a start point, what do we mean when we talk about periodontal plastic surgery? Well, this was defined by Miller and Allen back in back in 1996 in a publication for Perio 2000, when they described the procedures that we're talking about. And the sort of thing we're looking at is vestibular deepening. Now that, for me, is fairly historical. That's something that really goes back to when I was an undergraduate. We used to see these cases of patients who'd had full dentures since they were in their early 20s and had no ridges left. So we used to do all these very elaborate periostral separation techniques to try and increase the vestibular depth. Something that really I don't ever see or don't ever do. I will show a case of that later on because I work with Chris Butterworth and he does some very interesting stuff. So I will show you a little bit of that. But also aberrant frenum, frenectomy is something that can be very simple, but also, if not done properly, can lead to an awful lot of damage. Treatment of marginal tissue recession and the soft tissue grafting, and that is kind of what we tend to talk about most of all. And we'll be looking at that predominantly because it shows the techniques, the procedures, and how they can be used. Excessive gingival display and crown lengthening, I would love to talk about, but is a separate talk completely, so we can save that for another day, but comes under the realm of periodontal plastic surgery. We've got ridge augmentation, grafting extraction sites, the holy grail that is papillary reconstruction is something that we still can't really achieve. And then surgical exposure, unerupted teeth, and aesthetic defects around implants, which is something that is becoming far more of a challenge and far more relevant to the periodontists. So to start off with, I'm just going to look at the classification of marginal tissue, and this is a useful start point. And this comes back from Miller back in 1985, and Preston Miller is one of the big heavyweights of mucogingival surgery. And he defined 4 classifications of gingival recession. The first one is labial recession, which does not extend beyond the mucogingival junction with no loss of interproximal tissue. So the papillar tissues are all there. We've got keratinized tissue labially, but we have mid-labial recession. Class 2 defect, where we still have the mid-labial recession, we've still got the interdental tissues intact, but the recession now extends to or beyond the mucogingival junction. Class 3 recession, where we've got some loss of interdental tissue now, but the mid-labial recession is still more apical to the interdental recession. And then a class 4, where we've got recession, interdental, and labial, and they're at the same level. Now, this recession, or this classification system, isn't the sort of classification system where one proceeds to the next. It's not that a class 1 becomes a class 2, becomes a class 3, becomes a class 4. What this represents really is it's more of a clinical classification system. So it tells me as a periodontist what procedures I might consider. So, for example, class 1 defect, we've got good keratinized tissue around the defect. We may make a decision to coronally position that. Whereas in a class 2 defect, we're missing that keratinized tissue and it's quite